Essential hospitals are united by mission and by a long history of caring for communities. For many essential hospitals, that history reaches back more than a century. Much has changed in that time, but they have stayed true to their mission to provide the best possible care for all. Essential hospitals have changed hospital care for the better as leaders in life-saving services, innovation, and quality. When disaster strikes, people turn to essential hospitals for life-saving care. Laguna Hospital, now part of the San Francisco Department of Public Health, treated thousands of victims of the massive earthquake and fire that devastated the city in 1906. As the birthplace of hospital-based civilian trauma care, and now home to more than a third of the nation's Level 1 trauma centers, essential hospitals have a long history of saving lives. Temple University Health System in Philadelphia earned its reputation for excellent trauma care in 1903 by responding to a balcony collapse at a Major League Baseball park. Recently, Temple responded to one of the worst train derailments in the Northeast Corridor. These life-saving services wouldn't be possible without groundbreaking medical research to improve patient outcomes. John H. Stroger Jr. Hospital of Cook County in Chicago became the birthplace of blood preservation in 1937 when Dr. Bernard Fantis created the first hospital-based blood exchange. Today, the hospital's blood bank supports more than 15,000 transfusions a year. Nearby, the University of Chicago Medicine has pioneered cancer research for 90 years. The health system was the first to test nitrogen mustard to treat terminally ill patients with lymphoma and leukemia, a development widely considered the beginning of chemotherapy. Essential hospitals are dedicated not only to their local communities, but also to leading innovation regionally. Grady Health in Atlanta performed the first open heart surgery in Georgia in 1921. In 1940, the health system housed one of only 3 cardiac catheterization labs in the country. Likewise, 125-year-old Benefice Health in Montana brought state-of-the-art hospital technology to an isolated region, including a robotic system to treat tumors and other conditions. These innovations are rooted in a long history of commitment to quality care. Founded as an almshouse in 1736, Bellevue Hospital in New York City, now part of NYC Health and Hospitals, is among the nation's oldest hospitals and home to the first ambulance service. In the 19th century, Bellevue physicians brought germ theory from Europe to the United States and pioneered the use of antiseptics in medical treatment. Through the influenza and AIDS epidemics of the 20th century, the hospital turned away no one. In shifting and uncertain times, one thing is certain: essential hospitals always will be there, ready for the worst and relentlessly driving the best in healthcare innovation. They embody a shared mission of high-quality care for all, especially the vulnerable. And that's what makes them essential.